on pregnancy. It's beautiful, isn't it? It's wonderful. It's, you know, this life growing inside of you. Why does my back ache? Why does my neck hurt? Why am I in so much pain is what a lot of women say when they're pregnant. And that comes out of nowhere. You don't expect that. So we've got a chiropractor, Dr. Pande, who can help with some of those issues. You see a lot of pregnant women in your practice, right?
I do, actually. It's great.
What are some of the things they're complaining about?
Well, one of the main things that pregnant women complain about is not having their baby in the right position, so it's in a breech position. But they also come in complaining about low back pain or sciatica, also pubic bone pain.
Pubic bone pain?
That's right. So that's pain in the front, and it really affects when they're walking or sometimes when they're sitting. It's like a sharp, sometimes it's a sharp aching, stabbing pain. Sometimes it's an aching pain. So yeah, it's
and
quite...
is that just because of the position of the baby?
Well, it's position of the baby, but also there's a hormone called relaxin, and it relaxes your ligaments so that you can have a baby, but it sometimes does it in an unequal way, and then that causes the problems.
And that can also explain why a lot of pregnant women get the dropsies, right?
Yeah.
Because those ligaments, you can't grip things right as well.
That's right.
So, first question some people might have is, well, I'd be afraid to get a chiropractic treatment.
Right.
Because what if, is that going to damage my fetus?
Not at all. It's completely safe. There's no danger at all to the mom or to the baby. And so I make sure that all my moms know that for sure. The technique that I use is very special. It's targeted for pregnancy. So it's geared towards them, and it's a little bit different than regular chiropractic care.
Which is, explain what the regular is, and then we'll talk about the differences.
So regular chiropractic care is great, and it addresses spinal issues and nerve issues. With pregnancy, we use a special technique called Webster Technique. And Webster Technique was created to balance the pelvis, balance the spine, and the surrounding muscles and ligaments to make sure that a pregnant woman has a safer and easier birth.
That's right. And if one thing gets out of alignment, you might not notice that at first, but it throws everything else off, right?
Definitely, definitely. Sometimes women may have low back pain and they just, well, it's just a part of pregnancy, but then it ends up becoming sciatica or something else.
And it just keeps getting worse and worse.
Sometimes, yeah.
And the pain just keeps spreading and spreading. So they come to see you, does it matter at what stage in their pregnancy?
No, in fact, some women I see right when they become pregnant. So they're already patients of mine, and then they tell me the happy news, and then we start using Webster right away. I encourage women to come in early in their pregnancy so we can make sure that they stay balanced throughout the pregnancy. So they have a great, they're actually glowing, and they have a good delivery and a good birth.
A lot of chiropractic adjustments, you lie on your back, or you might even lie on your front, or sometimes on your side. Mm-hmm. So when you're pregnant and you've got all this sticking out front, how do you actually do the adjustment?
Well, I have these great pillows. They have an indentation that cradles the belly, protects the belly, so they can lay down on their stomach. And sometimes I have to really make sure that I have both pillows when they leave, just because they're so comfortable.
They shove them up in under their shirt. She'll never notice this one's gone.
Well, it's the first time they've laid on their stomach in a long time for some of them.
Yeah, now, you know, my daughter's adopted, so I never had to experience that, but I bet you would miss lying on your stomach.
Yeah. Yeah, it's really comfortable, and it's easy for them to lay down. It's easy to get adjusted. There's no cracking, twisting, or turning in this method, so there's no awkward positions that they have to get into. And
the cracking that we hear on traditional chiropractic treatments is what exactly?
It's just the compression of the gas that's between the joint that's being compressed, and then that's making that noise. So
like
it's
if you're popping
else.
bubble wrap.
Right.
It's not like bones or cracking.
No, not at all. We would never do that.
No, but it's a common misconception. People are afraid of that sound, and there's nothing to be afraid of.
Yeah, there's nothing to be afraid of.
Now, what if someone says, well, this is great. I'm not pregnant, but boy, I am in a lot of pain, and my periods are really painful. Is there anything you can do for that?
Actually, Webster was created initially for pregnant women, but then what's happened over the last 5 to 10 years is that it's we've realized that it can be helped with, it can help women who are having menstrual cramps or even infertility.
Really?
Yeah, and so so I have women who come in and they're coming in for a different reason, but on my intake form it asks them about menstrual cramps, and so we end up starting Webster Technique on them and helping them alleviate some of their cramps, which is fantastic.
That's amazing.
Yeah.
And they get relief.
They do.
Is it permanent, or do they have to keep coming back? How often should a pregnant woman come in for treatment?
Well, it depends on the individual case. If we're trying to help a baby turn, then we're kind of in a time crunch, so the more often they can come in, the better. But usually...
And this will actually stimulate the baby to move around?
Well, what it does is it allows the baby to have enough room. So if the reason the baby's not in the right position for birth is because the pelvis is out of balance and that's putting pressure on the uterus and that's preventing the baby from having enough room to flip over, then Webster Technique will really help. It's about an 85% success rate.
That's fantastic. All right, pregnancy happened, baby was born, it's very happy. Can the baby come in for treatment? That's a pretty rough journey through that tight little space. I would imagine there'd be a couple of kinks in the neck. Do you recommend chiropractic for babies?
I do. It's one of the things I focus on. And chiropractic for children is very different than chiropractic for adults. Now, the method I use anyways is very gentle. There's no cracking or twisting anyways. But with babies, it's even more so. So the amount of pressure I use on a baby's spine is the same as you would put comfortably on a closed eyelid.
Look at that. So if you had any concerns at all, I hope we've alleviated those for you. For more information, pande.ca, right?
That's right.
Pande.ca. Great information. When we come back, we're going to get some organizing tips with folks from Molly Maid. It's really cool.